कैम शो नमस्ते सत श्रीकाल आदाब के मुनाशन प्यारे दोस्तों प्यारे दर्शकों आप जी का निघा स्वागत है जस कैमरे की नज़र प्रोग्राम के दीपक तिमान हर सोमवार शाम को 7 बजे यह प्रोग्राम लैके हाजिर होंगे है 7 PM ईस्टर्न टाइम एवरी मंडे। इस प्रोग्राम के अंदर असी आप दे नाल सांझियां करते हाँ वो कहानियां वो स्टोरीज जो साडी कम्यूनिटी के अंदर जो ईवेंट होंगे है। अज का ये जो पहली स्टोरी है बहुत ही स्पैशल है जी कि कैंसर के उत्ते ईवेंट होया अवेयरनैस ईवेंट सीगा कि कैंसर तो किद्दां बचा किया जा सकता अगर कैंसर होता कि अमेरिकन पंजाबी सोसाइटी इन एसोसिएशन विद एपी खाली एंड इंद्रजीत बिंद्रा ऑफ नरगिस दत्त मैमोरियल कैंसर फाउंडेशन ये सारे रल के इस ईवेंट नूं कीता अवेयरनैस ईवेंट और मॉडरेटेड बाय डॉक्टर तरुण वासिल अते डॉक्टर जगमोहन कालरा। इस मौके के उत्ते कुछ पेशेंट भी आए सीगे जिन्हां नूं इस कैंसर वर्गी बीमारी तो राहत मिली हैगी आ। डॉक्टर तरुण वासिल ने उन्होंने अपन सेवावां दित्तियां हैगियां उन्होंने ट्रीटमेंट किया है। डॉक्टर जगमोहन कालरा और काफ़ी लोगों ने अपने जवाब सवाल भी किए जो सवाल किए और उन्होंने जवाब डॉक्टर तरुण वासिल ने जिन्होंने कि रिसर्च की उत्ते काफ़ी ज़्यादा वो भी किए है। और इस प्रोग्राम जो होस्ट किया है प्रोग्राम होया है परल गैरी सिक्का जी वालों। तो आओ आप जी लैके चलते हैं कि किस तरीके दे नाल उन्होंने इस कोलन कैंसर या मल्टीपल माइलोमा के उत्ते गल की हैगी आ।
With the help of some of my friends who I've known and respected and loved for over many decades. So this morning's event is a combined effort, first and foremost, of our host, Mr. Gary Sikka from Minton Pearl, who heads the organization called American Punjabi Society.
Good morning. Thanks for coming. Thanks to each and every one of you who has been able to make this event early in the morning on a Sunday. We did one program on cervical cancer in the month of January, and then we did one in February and one in March, and we are doing another one in April. So we'll try to do as many programs to make people aware of various cancers and the management that has changed in the last few years. So I'm going to invite Dr. Kalma. It's a rare cancer.
As a community, especially Indian community, we have been around for so many years seeing patients. However, we haven't brought to community how do we be aware of these cancers which are rare but can happen to us too. Other cancer, you can have symptoms early, you can go to the doctor early. However, with this cancer, unless you go...
That's about multiple myeloma in brief. And if we want to talk about myeloma, we can spend almost 10 weeks. But there's so much research out there. So,
to tell you, in 2015, suddenly I felt some pain on my back, and I was finally diagnosed that I have some problem there. I spoke to Dr. Wasil. I was that time in North Carolina. I spoke to him. He said, "Either come back to New York right away." Wasil's office, and he told me the whole story, everything. And then same time, I got that chemotherapy in his office. Same time, 8 o'clock we had a meeting, 9 o'clock I have a chemotherapy.
For an X-ray, and then he did a bone marrow and everything, and it came out as myeloma. And he has been treating me from 2021 completely. And I can tell you that great result.
Then any medication he start, every time I get a severe reaction. He had a hard time with me because so he has to keep changing. Right now I am okay.
Available to us, and this has happened just because of all the brilliant scientists and the patients and the family members and the philanthropy that has afford to do all those things. But in solo practice, it's very hard. And again, as Dr. Bagla mentioned that doing sometimes more tests is more beneficial. And anytime we see a patient above the age of 60 with anemia, we look for this abnormal protein. Including your intermittent fasting or fasting mimicking diets, which are very popular these days because cells, natural killer cells go up. Each and every of these components have that. Few hundred articles I can quote myself because I have written a book on these things also. And so basically it is very important. That's why we talk every meeting. I bring this slide up. Stress management. And so far as family history, colon cancer is concerned, we're going to discuss that. So there are a couple of well-defined syndromes. One is called familial adenomas. And colon cancer is increasing in people below the age of 55. And that is an increasing health risk at this point because we are seeing a lot more people with age 55 and below getting colon cancer. And that's why last year ACS, American Cancer Society, came up with guidelines that we should start screening at 45, not 50.
To our Punjabi society and to all the doctors, if there is any way we can make a directory of all the names and the doctors' phone numbers, which can help people reach out. Like for me, I'm looking for a gastro doctor. I haven't found one yet.
Punjabi society, especially Dr. TARUN WASIL, Dr. Chawla, President of the QLI, and thankful to Dr. Indrajit Singh Bindra from Narcissus Cancer Foundation. I'm thankful for each and every person who came here today. And now we are having next our program very soon. We are doing Vaisakhi program on 3rd of April, and I will invite each and every person who's here. It's a dinner program, and address is already written there, and on 3rd April next month.
ਅੱਜ ਦੀਆਂ ਕਹਾਣੀਆਂ ਇੱਥੇ ਤੱਕ ਹੀ। ਅਗਰ ਤੁਹਾਡੇ ਕੋਲ ਵੀ ਕੋਈ ਕਹਾਣੀ ਹੋਵੇ ਤਾਂ ਤੁਸੀਂ ਮੈਨੂੰ ਭੇਜ ਸਕਦੇ ਹੈਗੇ ਆ info@justbroadcasting.com ਜਾਂ deepak@justbroadcasting.com ਦੇ ਉੱਤੇ। ਅਗਲੇ ਹਫਤੇ ਕੁਝ ਹੋਰ ਕਹਾਣੀਆਂ ਲੈ ਕੇ ਹਾਜ਼ਰ ਹੋਏਗਾ ਦੀਪਕ ਤਿਮਾਨ ਜਸ ਕੈਮਰੇ ਦੀ ਨਜ਼ਰ ਦੇ ਵਿੱਚ। ਇਸ ਦੇ ਨਾਲ ਹੀ ਦਿਓ ਇਜਾਜ਼ਤ। ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ, ਰੱਬ ਰਾਖਾ।